the Medical AI Podcast.
Hello, I'm Dr. Felix Beecher, and this is the Medical AI Podcast, a 30-minute thrill ride of big ideas. We talk to a range of top guests, from industry innovators to scientists to philosophers. This is brought to you by Informatech, where I'm the head of healthcare technology. Radiology is a classic area of medical AI. AI systems for medical imaging analysis have several major advantages over human radiologists. For example, they can be trained on millions of scans, far more than a human can be. They can give results instantly. And many studies indicate that in many contexts, AI systems are more accurate for disease detection and diagnosis. Well, that's the promise, but what is the reality? Where is the field at? What are the successes and failures? With me to discuss all that is somebody at the leading edge of this field, Darren Stephens, Senior Vice President of Qure.ai. Darren, a huge welcome. I'm really excited to have you here.
Thanks very much, Felix. Thanks for the introduction and also the invitation onto the podcast.
So, Darren, could you please introduce yourself and a little bit about Qure.ai?
Of course, no problem, Felix. Well, my name is Darren Stephens, and I'm Senior Vice President and Commercial Head of UK and Europe at Qure. And essentially, Qure is a breakthrough artificial intelligence solution provider. Our technology, Felix, enhances image accuracy and improves health outcomes with the assistance of machine-supported tools, which there's an awful lot of talk in our world right now about. So our mission is very simple, and that's to make healthcare more accessible and affordable to patients worldwide with our technology, Felix.
Okay, now I should point out at the start that Qure is spelled Qure, right? So if people want to Google your company, that's what they should look for.
Absolutely. So Qure with a Q. And actually, a lot of the products, the services that we provide have that nomenclature as well. So we could talk a little bit more about that later as we go through.
Great. There's a skincare company with a very similar name, by the way. Did you know?
I'm waiting for my WhatsApp to literally just explode now with messages left, right, and center. So thanks very much for that, Felix.
If you get asked for moisturizer, you'll know why. And I'm hoping that they're not doing image analysis on X-rays as well, but maybe they are.
Who knows? Anything's possible.
Okay,
yeah,
great. Well, look, Darren, could you just explain a little bit about where you are as a business? When were you founded? How big are you? What kind of commercial operations do you have, and so forth?
Absolutely, no problem. So we're an Indian company, founded in 2016, and we've got headquarters in Mumbai and Bangalore. But we're a growing international story now, Felix, and we've got a UK entity and a US entity as part of our operations. My focus within the company is to build out the UK and European operations to support the end users that we have and as we grow and deploy in those regions. So we currently stand at about 240 employees globally, but that's steadily growing.
Now, you also have a very impressive list of partner organizations, including the NHS and AstraZeneca. Could you say something about those partnerships?
Absolutely. The area that we work in is extremely diverse. The applications for our technology right across all of those various partners that you've suggested, extremely exciting. And we've got an active partnership program within our organization who work with all of key partners, vendors, modality providers, large pharma, research bodies, and then healthcare systems that we can support as well. So very proud of the work that we're embarking on, the work that we've achieved to date, and the exciting projects that we have down the road as well as part of all of that.
Okay, well, let's talk about the technology that you have developed. Could you just introduce that in general?
Yes, absolutely. So Qure taps into deep learning technology to provide automated interpretation of radiology exams like X-rays and CTs. And what this does is it enables faster diagnosis and speed of treatment. Our software is vendor agnostic, meaning that we can integrate into existing radiology infrastructure easily. The solutions can be deployed from a cloud or on-premise. And what the software does is it identifies abnormalities on patient scans within seconds. Then it presents these back to the clinicians reporting these in a number of different ways. And the software creates a secondary capture for the clinician with an overlay of the findings, Felix. And the clinician can then review these findings quickly. They can compare them to the original images and then move forward with the report and next steps for the patient.
So is it chest that you're focusing on here?
So when you actually look at the areas that we provide, which we actually kind of can facilitate, we offer actually a portfolio of AI solutions. So we offer a comprehensive X-ray solution, and this enables detection of lung nodules, tuberculosis, fractures. We also have a chest CT product then for lung cancer. We strongly believe that early detection is key and will lead to better patient care and outcomes, Felix. So that's essentially the focus that we've had with our portfolio to date. And we also have a solution for head CT, and that's very interesting, looking at stroke, midline shift, infarcts and bleeds. And ultimately the aim here is to provide faster diagnostic support and also be able to manage that kind of disease progression monitoring as well for clinicians. That's quite important.
Yeah. Now, let's take a couple of examples you mentioned there. So in the case of lung cancer, there are different types of lung cancer. Can those be diagnosed on the basis of CT or MRI? And can your systems distinguish between those subtypes?
So in terms of, it's actually a very interesting conversation, because really what we're using with the technology, or what we're doing with the technology, is helping clinicians redefine patient pathways and getting through a diagnostic pathway quicker. And traditionally, there is a stage of activity that needs to be completed for a patient that enters into a pathway. Perhaps for lung cancer is a perfect example. Unfortunately, lung cancer tends to get diagnosed far later than we would like to. And a lot of this is because it can go undetected for quite some time before it's picked up. And normally, quite sadly, it's picked up within secondary care for some other presentations that the patient presents, into A&E or some other pathway within the hospital. And this is picked up through diagnostic tools. So really what we're trying to do is create technology or solutions that are able to run on your X-rays, your CTs, and identify those abnormalities earlier, subtle findings, subtle abnormalities, and present them to the clinician. So it's like a second set of eyes for the clinician, ensuring that nothing is missed and is picked up, certainly in its early stages. That's quite important when we're looking at the national pathways for lung cancer and the management of patients through that. And at the moment, that sits at something like 62 days. And essentially with our technology, what we're trying to do in some of the projects across the UK is looking to shorten that. And how we can do that is we can identify those abnormalities through a triage using one of our products called QXR. And essentially what it will do is alert an abnormality to the clinician and allow that patient to progress through to the confirmatory diagnosis, which CT forms part of that as well. So it's really interesting to be providing solutions that can offer assistance at various different stages of kind of the care and management of patients.
Okay, now let's take the example of a stroke. Now, stroke is essentially when blood flow gets blocked in the brain and brain tissue either dies off or can become compromised. Now, stroke can take many forms. You can either have a mini stroke or a major stroke, and it can occur in different regions of the brain. So if you had somebody in presenting with stroke-type symptoms and they had a scan, and that scan was analysed by your kind of systems, what information would be given to somebody reviewing that?
Yeah, so essentially the patient would be imaged, and through that, on top of that image, then the software will kind of provide its secondary capture, and the secondary capture will identify the abnormalities, bleeds, whatever the presentation might be, and that's crucial in an emergency setting like we're talking about here for stroke, because when you think of what happens next then in terms of treatment for that patient, is there a situation where they're moving towards thrombolysis, or is it a case for thrombectomy, whereas you're moving the patient towards a mechanical removal of the blockage, etc. To be able to provide a clinician with a timely and safe and accurate representation of really what is happening with that patient is hugely helpful, because it provides a confirmatory. It also ensures that nothing is missed, and it also improves the speed of the interpretation of the results and getting that report back to those clinicians. Because if you think about it, you have a situation where you have this patient who's a stroke patient and needs immediate attention and needs that decision very, very quickly. So it's very, very important that the clinician is able to provide that stand down or proceed depending on what the next course of action is. So when you actually look at our solution, when we've deployed that across various clinical settings, from everywhere from university hospital stroke centres through to teleradiology and outsourced teleradiology providers as well, we're seeing anything from a 15 to a 45% increase in efficiencies there, which are considerable, Felix, when you actually look at that time is brain argument.
Absolutely. Look, let's imagine hypothetically that we've got two hospitals and they both have your products operating, but one is a technophobe hospital, the other is a technophile hospital. In other words, in hospital A, they're treating your system with a lot of suspicion and they're only using it with a lot of oversight. In hospital B, they're trusting it and they're using it to clear backlogs because they're short-staffed with radiologists. Now, it seems to me that if your system is really good, then hospital B will be doing something very good for their patients because they'll be using it to clear that massive backlog of waiting people. Whereas hospital A, actually, there's not very much value to your kind of product because it's not being used to expedite medical procedures. Is that a kind of fair comparison?
I think it's a really interesting question that you pose, Felix. And really, when you step back a couple of years ago, I think those differences would have been far more extreme. I think literally only a couple of years ago, there was the question of around AI, does it actually work? Will it actually provide the results that we need? Can we have faith and can we actually trust in the technology? And the conversation certainly the conversations that the team and myself at Qure are having with our end users has moved on quite considerably. It's interesting to actually look at how the technology then is used between hospitals, because one hospital's use case might be very, very different to another hospital's use case. And when we actually see those differences in reality across, say, the NHS, one trust might require the need to use this technology in a triaging use case. Another hospital or trust might decide to have it as an audit or second set of eyes. Another hospital might choose to use it to triage and prioritize reporting lists. So there's a lot of very different applications of the technology. I think what we're finding now, though, is a movement, thankfully, towards acceptance of the technology. Those that have been tried and tested and created local evidence and are safe to deploy within the hospital environments. It's now more about how can we actually use this within our practice, within our hospital, within our trust, and that could vary quite a bit from trust to trust or from hospital to hospital, site to site.
So, what do you think are the really key benefits to end users of this kind of, well, not just to end users, to patients as well, of these kind of systems?
Really, you need to start with where the problem is. So when you actually identify, well, what's the major issue right now within these environments? And it's down to resources, Felix, and there isn't enough of anything. So we haven't enough radiologists, we haven't enough radiographers. Yeah. And what we're seeing actually is, growing, increasing demand for diagnostic services. So it's quite a challenge for healthcare systems. And, it takes that set time to train and, upscale and educate that clinical workforce. We need to do smarter with the resources that we have. We need to make those kind of marginal gains and those investments in things that will give us marginal gains so that we can augment the clinicians that we have. And that'll ensure that we get the most out of the precious clinical resources that we have, be that radiology departments, reporting radiographers, radiologists, etc. So that's really where I think the most power can be gained. And sometimes if you just kind of generally meet somebody and they ask about what I do, and we get talking about, well, I work in artificial intelligence and AI, the immediate knee-jerk reaction to that is, oh, is that the thing that's going to come and take all of our jobs? and it's a really funny, interesting conversation to have, and it can be quite frustrating too, because that's not how we see the use of the technology. The first thing that we need to take note of is that there aren't enough bodies there to fill the vacant posts that we have right now in terms of vacant radiologist posts and radiographer posts across the UK, for instance. So, we're not replacing anybody anytime soon. And
sure,
this is about how can we augment that precious resource we have. And ultimately, how will clinicians into the future work with AI, redefining their career paths, potentially redefining maybe some specialisms as well within the healthcare ecosystem. And in a previous life to this, Felix, I worked in pre-analytical robotics within pathology, and there's the same concerns there when those machines arrived into busy pathology labs, biochemistry labs, or blood sciences labs. And the fear was, my gosh, this robot is going to do all of the sorting and all of the technical tasks that I do on a daily basis. But when it was actually reframed and they realized that actually this could become, I could become a subject matter expert and a specialist in this space and adopting the technology and being a champion for the technology. And that's exactly what happened. And now what I'm starting to see is that very same story within AI.
Okay, well, let's talk about autonomous diagnostics. This makes people feel very nervous in the field, I've noticed. Why do you think that is? Why do people really try and avoid talking about replacing radiologists?
Well, it's really down to the whole trust, education, and demystifying AI in a lot of ways. And I think a lot of work has been done. We've covered considerable ground in the last couple of years, last 2-3 years. We've covered considerable ground in that regard. I think the problem that we have is that we need a situation where everybody is educated at the same level on the use, application, and different use cases of the technology. And the problem that sometimes arises is when maybe either certain parts of our community or certain individuals within our community might step forward and make a claim like it's here to replace us type arguments, and it can set back that conversation. It can set back the hard work that's been done, because really, if those individuals were to actually talk to the clinicians I deal with on a daily basis and speak to the technical teams supporting this technology, it's very much a collaboration piece. We're augmenting the experience of the clinicians. We're not there to operate on our own anytime soon. And there's an awful lot of supporting evidence that's required in order to progress us along that story. At Qure, it's something that we've invested heavily in, and we're very excited recently to have our CE Class 2B certification for the European Medical Device Regulation certification, Felix. And that provides us with the most comprehensive certified portfolio of AI-based detection devices right across Europe for radiology.
Yeah.
And in order to attain those levels of certification, you really, really need to provide the highest quality clinical evidence locally. And that was something that, we'd focused on as an organization, and I'm very proud to now have that. That's still quite a way from operating fully autonomously. However, there's another part to this story as well, and this is around guidelines and acceptance of use and consent and exposure to radiation and all of those things that have a human clinical capital element to them. And, serious consideration needs to be taken in how those are managed and how things progress, in regards to that. And I think what we're going to see is small steps every couple of years towards further evolution of the area and of the discipline. But at the moment, I know it can be frustrating for clinicians as well, Felix, because there are some extremely intelligent, talented people out there who are pioneering and adopting this technology, and they're doing so in a very responsible way.
Yeah.
And for us, that's our license to operate as well, Felix. So we're extremely passionate about making sure that we're operating at the highest clinical quality and that we're supporting the clinicians involved in adopting the technology.
Okay, that makes sense. So you're working on autonomous diagnostics, but you're not there yet. However, if one looks at the scientific literature, one can see gazillions of studies showing that AI systems have been developed to outperform radiologists. Now, what's the difference between those scientific studies and actually developing systems in the field which can do that?
It's really interesting because in a lot of ways, even within our portfolio, we currently have certain clearance for reporting a normal chest x-ray, for instance. However, that still needs to be signed off and approved by your clinician, be that a reporting radiographer or radiologist. However, if guidelines were to change and evolve and move more towards accepting some of those disciplines to operate in that way, certainly there are companies like Qure who will be ready and in a position to be able to step up to that mark. And the important piece to support that is local evidence. So we can create an algorithm and it can operate in controlled settings very, very well. But when you actually bring it out and deploy it within a clinical setting and start to actually deploy it within different environments, we want to make sure that we're generating really strong evidence to prove its efficacy as well. And
right.
That's something that we're certainly very, very proud of the work that we've done to date, and we're excited to see where we can take those studies into the future too. But very much that's a hand-in-hand piece that's working closely in close collaboration with clinicians all the way.
Yeah. Okay. Now, look, one thing I'm really interested in is how you compete with major equipment manufacturers, because Qure is a fantastic company, I've no doubt about that, but it doesn't have the funds, as far as I'm aware, to throw at these kind of problems as, for example, GE Healthcare or Siemens. Now, GE Healthcare and Siemens tend to sell their equipment with AI systems already embedded. So how do you compete in that environment? It seems really tough.
It's funny that you use the word compete, actually, Felix, because it's not the word naturally that would come to my mind, because all of those large vendor, those big companies, those big kind of modality providers, those big PACS-RIS companies are really, really important partners for us. So a lot of how we deploy our technology, we deploy directly to the end user, but in a lot of very complex scenarios, we partner with the PACS-RIS provider for a hospital environment, for instance, or maybe the modality provider for a particular healthcare system. So we certainly see them as an integral part to our future success, and ultimately enabling choice for the end user, because the end user might, wish for the technology to be deployed in a certain way. So we have to be able to provide those options. I think to answer your first question, the question that you really asked me is this kind of the investment that a large company can put behind a piece of technology like AI, and how it might be able to pool its resources together. What we've certainly seen is that they may focus on one particular area and try and do one particular algorithm, and because there's so many other competing interests within a lot of those larger organizations, and might not have the agility that certainly our company has demonstrated over the last couple of years, and also the ability to be able to really focus on what's important, that window, that AI, that algorithm, that portfolio. And that's ultimately what we've spent the majority of our time on, is developing that broad portfolio approach, and operate from a disease perspective, as opposed to an algorithm versus algorithm. And what we're seeing now is a maturity in the marketplace around this. And, certainly we've got, as I said, very strong relationships with nearly everybody that you could possibly think of within the marketplace, because we have to provide those options. There's also the development now of AI marketplaces as well. So we will work with those, where we've got companies who are providing a platform to allow multiple solutions to be deployed to healthcare systems as well. So that's an interesting development that we're starting to see more traction in now as time progresses along.
Okay, so I can imagine that major X-ray manufacturers and CT manufacturers might embed software for major diseases on their hardware. And then hospitals might look at smaller vendors of software and think, well, we don't need those because those are being provided already by the manufacturer. But maybe where the opportunity is for the smaller software vendors is more niche disease areas. Is there something there?
We're seeing in both arguments, and also in terms of the evidence, the specialism within those teams as well. And just like us trying to ensure that we've got choice for our end users, and making kind of that interoperability story right across all of these various verticals, the vendors themselves are also wanting to offer that to their end users too, because if you think about a lot of the big vendor contracts, they're much longer terms as well, Felix. So a lot changes within the marketplace from over a 15 or a 10-year contract. And I think certainly what we're seeing from a vendor's perspective is the ability to be able to provide choice within their own contracts then as well, and within their own platforms, and to also be as agnostic as they can to enable interoperability. Because up till about 2 years ago, one of the biggest barriers to a lot of digital transformation was archaic systems interoperability. So I think big solution providers who can show that they're very much an open platform with the ability to work with many different vendors and many different solution providers, those are the ones that are going to grow, succeed, and develop deep partnerships with their hospital clients.
Okay, Darren, so what would you say the main challenges are that you face as a business currently?
That's really interesting, Felix. When you actually kind of reflect on challenges, I suppose the biggest challenges that any new innovation faces when it's first introduced into the market, or into an ecosystem, or into a hospital environment, is really proving return on investment. And a lot of new innovations start in a pilot or trial phase, and then have to move towards, well, can it live and breathe, and can it be commercialized? I think that's been certainly a challenge, not just for Qure, but for the market. And I would see, a lot of my my kind of fellow colleagues from other companies within the market probably feeling the same and having the same challenges. So, what we focused on is we make sure that we create solid evidence for use cases, and then illustrate all of the direct and indirect benefits associated with its routine use. And then it's possible to illustrate really really important kind of health economic arguments and models then associated with its adoption. So I think it's all of those moving pieces, and ultimately leading to a funding model for a lot of this technology as well, and for it to become more mainstream and considered part of a budget of a healthcare provider. And that's bringing the conversation beyond the radiology department, but more to a macro level right across the organization. And that's where it gets really exciting. That's where it gets really interesting, because there's a lot of technology traditionally that might be deployed within any department that serves that department. The technology that we're talking about here today, it can serve organizations. It lives and breathes beyond the radiology or imaging department, because it can provide real returns for organizations, not just departments.
Okay, well, look, Darren, you've given a beautifully clear account, and thank you very much. There's just one last question, though. It's the question I always ask, and that is, what's your favorite example of medical AI, nothing to do with Qure?
Yeah, really, really good question. And I suppose it kind of harks back to my past. I spent some years in pharmaceuticals, and in my early career, that's certainly where I started on the commercial side of pharmaceuticals. And I saw back then how long it took to actually bring novel, new, high medical value products or molecules to market, and I definitely seen some exciting stuff happening in the world of AI around drug discovery. And there is quite a few companies there and a few projects that I'll be keeping a close eye to over the next couple of months to see how they evolve. But certainly that's the one that I find most fascinating, Felix.
Great. Well, look, Darren, it's been an absolute pleasure speaking with you, and I'm very grateful to you. And I'm sure that Qure will go from strength to strength. And thank you so much for coming on.
Thanks for having me, Felix. Lovely speaking to you.
Okay, bye-bye then. Thank you for listening. I'm Felix Beecher. Ping me on LinkedIn for more information on Omdia's services in healthcare technology. See you next time.